I got fired during COVID for taking my mask off, caring for an old guy who was dying of heart failure.
Yeah.
Take my mask off. I don't need this thing.
Yeah.
Trimmed his toenails, rubbed lotion on his fin. We watched baseball, made him some soup. The next day, canned.
That's how you want to do it.
When you got fired?
Yeah, I was a chief resident, actually. I was in the last couple of months of my training. And it was a week before my first child was born. The fact that my child was going to be born gave me the courage to decide what kind of a human am I going to be for this person that's coming into the world. Like, am I going to be someone who cowers, or am I going to stand for what I believe?
And frankly, if we have all the answers, medicine doesn't become very fun anyways. So I think that the best physicians out there are those who are the most humble about what they actually know. And if we're true in answering that question, we don't know anything about anything. I am totally perplexed by the whole thing. And that then allows me to enter, using all the tools that I have, but enter into a conversation with a client knowing that I may not have any clue what's going on. And that makes it exciting, it makes it fun, and it helps them feel heard.
When I was a trainee, we would get pimped during conferences and stuff. I remember so many of my colleagues, they would be mortally afraid of not knowing the answer and then voicing that. So they would just try to BS artist their way out of like showing the world that they don't know. And it became so pathological that there'd be a network of them that would whisper answers to each other because they're sitting next to each other so that they can sound smart.
But man, I wouldn't have put that as one of my 3 principles. But nowadays, you're right. Being courageous is absolutely critical for you to be a good physician. And that's a little bit of a kind of a tragedy, I guess, in a way.
Joining me today is Dr. Nathan Riley, who is an OB-GYN, who also promotes, practices, and supports women who would like to birth at home. Nathan, thank you for joining me.
My pleasure. Thanks for having me. It's a real honor to be invited to a podcast interview with another MD. It's pretty far and few between for me, so thank you.
Yeah, no, I take inspiration from people who have done the hard work of finding MDs like yourself. I first saw you talk with Alex Zek on the Way Forward podcast. And since then, I guess when people hear this, they'll have already seen the interview with Dr. Stuart Fischbein, and now you will be the follow-up to that conversation.
Yeah.
So, yeah, I'm really excited to have this one. But the conversation with Stu started out a bit dark, and maybe we can start this off a little bit more light, and then maybe we'll get into the deep and dirty of it afterwards. So how do people come to you usually? And by people, I mean, women and couples who are interested in birth. How do they get to a physician like yourself? What are the most common reasons they come and seek you out?
It's almost invariably that because they had some reckoning with what we call our system, the medical system. What I like to sometimes call the medical industrial complex. I'm sure you're familiar with that term. Sometimes it's, they had a really bad experience with their first birth. Sometimes it's they've been passed from, punted from one specialty to the next. They can't figure out what's going on. You recently just posted something on Substack about like neck pain or something related to disc herniation or whatever. And they've been told that's the problem, there's no solution for it. The MRIs maybe don't even show anything, but this has to be it. And so they're kind of left with the symptoms and whatever it is that they present it with, their chief complaint. And nobody seems to have any answers apart from maybe palliating their pain or whatever else. For the most part, when people come to me, it's because they view childbirth. I mean, that's really where most of my time is focused, is in childbirth. And one small correction, I don't call it free birth. Free birth is when you go completely without anybody. But I do support people doing that. If they sometimes have a question, then the haters will say, well, it's not a free birth. You consulted with the doctor. They're trying to do this in the most spiritual way possible, which sometimes means being alone, maybe with your partner, maybe with a doula. Everybody has a different definition of free birth, but I'm really an advocate for home birth. And really, I'm actually not even an advocate for home birth. I don't advocate for that. I advocate for what is it that you, the woman who's going to be going through this sacred transformation, what is it that you really feel is right? And if I'm not listening to that, I'm missing out on the whole biographical sketch of who you are and where you want to go. So that's how people find me. You know, I don't advertise a lot. I mostly am on Instagram just to like share ideas and I don't know, gesticulate on certain things. It's kind of a boring space to be in, honestly, because everybody seems to be very strongly opinionated about things that they know nothing about, including me when I've never had a baby. So how can I be an expert
Yeah.
in childbirth? I've never given birth.
Yeah, that's true. That's true. Yeah, that's. I'm lucky that my wife, well, I guess I don't know if it was just her. I'm sure I had some influence on her because, before I started writing online, I would come home and rant about all the BS that I've had to put up with in the hospital, and she kept telling me to write and write and write, and then eventually I took her advice and started writing. But I'm sure my rants had some influence on her in the sense that she started to perceive things differently when we were
Really?
pregnant with our first child and was going through the prenatal pregnancy
Yeah.
follow-ups, all these kinds of stuff, and then the birth. That really, because like through the whole pregnancy process, I kept thinking like, why are they doing this?
Yeah.
I don't think you should do this.
Even
This
as an
seems
MD,
unnecessary. And I was a resident at the time. I was like, this is also a waste of money. Like,
Yeah.
we shouldn't be paying for this.
Yeah. Right.
And then it wasn't until I think maybe like late into the pregnancy and then she delivered in the hospital that everything kind of crystallized for her that this is wrong.
Yeah.
This doesn't feel right. I can see why women need epidurals. They develop, some psychiatric issues after they deliver. They feel distant, even
Yeah.
exactly, yeah, distant, even resentful of the child in some extreme cases. And so that's when I think that like really clicked, and she was like, okay, the next one we're really going to try to do this at home.
Yeah.
And so since then we've had 2 home births. We had a midwife for both of them, but both times she never made it on time, so I ended up being the one to hold her while she delivered her babies. So yeah, it's
Even better.
it's the whole like they say there's one of the best ways to make an atheist is have them go to like seminary school or something. It's kind of the same thing. It's like one of the best ways to motivate someone to try to do a natural birth is to actually have them go through
That's right.
the medicalized process.
Yeah. And sometimes, can I call you by your first name? Or is that like a secret?
Sure, yeah.
I love your name. Sometimes, so when people are very confronted by my advocacy, typically they actually have, I don't want to call it Stockholm syndrome, but in some ways you're not left with any option but to really just praise the doctor who did that C-section, right?
Mm-hmm.
Or did the interventions. Because at the end of the day, you and your baby are at home, you're cuddling, and you're like, wow, this is so great. Thank goodness we have the medical system. And that is true. It's great that we have a medical system that trained people like us. It is awesome for acute care. If you have an arm amputated, we're not going to grab the midwife. Like, we're going to go to the trauma surgeon, right? But sometimes I think the other type of person that feels very critical hasn't experienced a home birth like you have. And maybe until they have that super, highly interventionist way of going about maternity care, it's only then that they can actually shift their sort of frame around some of the issues. And I'd be curious when your when your wife came back after that first hospital birth. I presume you have 3 kids now. Is that correct?
Mm-hmm.
What was the thing that stood out to her?
From the hospital birth?
Yeah.
Well, she didn't have to kind of say anything. It was visible from the condition that she was in. It's as if all vitality was drained from her, completely exhausted, barely had the energy to even like hold her baby. Like as if a ghost, like completely pale. Like the whole process is just so. This is the thing that people, whenever we tell people about the fact that we had a home birth, they say, well, what about the risks of having a home birth? And it's like, yeah, but what about the risks of even having a completely standard, uneventful hospital/medicalized birth?
Right.
Like that has tremendous
Totally.
costs, but it's not even perceived as a cost. It's not even perceived as a risk because it has short-term risks and long-term risks. But I think people are only oriented towards the catastrophic things that might happen at home without a doctor present, as if those don't happen in the hospital as well. So that was like for me, as the partner in the process, and I was there for all of the birth, at the home birth, it was like she just went to the gym and came back and looks like refreshed,
Yeah.
Compared to when she was at the hospital, it looked like it was just drained, like completely gone.
Right, so what is that? That is really the crux of our conversation. What is that thing? It's not measurable. It's not like she came back and said, my blood counts are better, at home. They're way better than they were after the hospital. She's not talking about her vital signs. She's not talking about anything of import, what I learned in 4 years of hard residency training. So, yes, there's little whiffs of that. But if I might just plunge into this notion that most of us start off in like the biology world. I was a Spanish literature, like a humanities student, Spanish literature.
Oh, nice. Okay.
And I took some martial arts stuff in college and some arts classes and some music classes. And then I had to round out what we call like the pre-med requirements because I knew I was going to med school, but I was balancing these two worlds that didn't seem to bleed into one another. And the reality of biology is, right, it's the study of life, but we don't have a clearly defined definition of what life even is. And that's a really neat thing to explore. But furthermore, we don't have a really clear definition of what consciousness is or intelligence. This is where we get into like UFOs and artificial intelligence and life outside of, planet Earth. And then, of course, when does life begin in the uterus? And this doesn't have to turn into a conversation around abortion because I don't believe that the abortion conversation even touches this on a really sacred level. What did your wife experience that was not measurable, that felt wrong in the hospital? That is a really important question that nobody seems, in the system anyways, seems to be willing to lean into with curiosity. So if we were to even just talk about intelligence, which is relevant because you and I were valued very highly from the time that we were maybe 12 or something. And somebody said, I'm really good at whatever, taking tests, reading, writing, arithmetic, whatever. And so you were rewarded with more school, and you were rewarded with more school. And somebody you just kept rising to the top of the proverbial cream or milk. And we skim that off and we call you a doctor. Right, after you've gone through all these years. Now, there are certain things that physicians are going to do better than most people. We are highly analytically intelligent. We can see a whole bunch of pieces and see how they go together. We can take a hard problem and come to a solution faster. That's what all the test taking did for us. But back in, I think it was the early 80s, there was a guy named Howard Gardner who actually elaborated. I think he was coming through the lens of child psychology. He elaborated on the multiple different types of intelligence, which includes linguistic. There's some people that speak 8 languages. They may not have any clue how to do a stoichiometric, problem solving within a chemistry scenario, or they may have no idea how to do advanced calculus. But they can speak 8 languages. And how do they keep all of that oriented in their brains? And there's this logical, mathematical, this kind of reasoning side, which I think we're so incentivized to flex. We have spatial intelligence. I have them written down here because there's so many. Musical. There are certain people that can play music that nobody else can play. But they maybe can't even read. They may not even be able to read sheet music, but they know how chord structures go together. There's interpersonal, there's intrapersonal. There's naturalist. If you go down to the Andes or the Amazon, they would think we're insane for not being able to identify which plants go where. And they didn't learn that in a botany textbook. They learned that through oral tradition and experimenting and actually connecting with the intelligence of plants. Then, of course, later to his theory, there was 8 there. Later, they also then added, whoever they is, added this existential intelligence. What is your ability to think outside of the bounds of what is considered the human being's sort of role in the world? And the reason I'm presenting all of this is not to get into the myriad of ways that people interact with the world, but if you are only incentivizing people to go into the healing arts because of their ability to rationalize through mathematical or physics or whatever problems, you're going to end up with an ilk of humans that are very, very good at that. And maybe they become surgeons because they also have the spatial stuff, right? And some of them also, yes, can play instruments. I don't mean to diminish physicians. But the point here is that question of what your wife came home with, that loss of vitality, is not a question that is easily answered if you're giving it to a person who's good at mathematical reasoning within the sciences. So that leaves us with a very, very, it's almost an emotional contagion whereby suddenly when you start to get a little whiff of like, maybe this isn't good, through cognitive dissonance, you start to actually push back on that feeling that maybe I'm missing something here.
Yeah.
And we just settle back down into the PubMed search to get all the answers.
Yeah.
Most of us aren't even good at that.
Yeah. That's true. Yeah, that kind of goes back to, one of the things I talk about frequently are what are the traits of a good doctor, and have we actually created a system in which we're selecting for the appropriate traits? Because as far as I can tell, the modern medical apparatus, whether it's the industrial component of it or the academic component of it, it seems to be kind of a hangover of the Industrial Revolution, where everything is very compartmentalized, it's machinated, it's algorithmic, and unfortunately, most of life ain't those things. It doesn't even matter how you want it. If you want to just look at it from the perspective of health or disease, like every aspect of it is messy, it bleeds into one another. One of the things that I've been wrestling with is like, what are the dimensions of existence that we have to consider when we're trying to understand who a person is and how that relates to their health? And the conclusion that I've come to so far is that there are all these, let's try to make this easier to understand. Personality comes from somewhere, right? Like people have personality. Where does that come from? Is it a soul projection onto our, physical being? And so if that's the case, and I'm of the belief that personality is just one manifestation of the temperament of our being, because we have a physiologic personality, you can think of it this way.
Yeah.
So if that's the case, then is something projecting down through all these dimensions and then kind of consolidating into our physical being? And
Right.
And we know all of this stuff, really. If we just think about it for a second, we know that childhood trauma has impact on us physiologically. We know that immediate trauma has impact on us physiologically and psychologically. And there's interplay of all these different dimensions. So why the hell is it that we're only thinking of humans as machines, and more to the point, treating women and childbirth as lab experiments? Because really, if you think about it, all of the instrumentation, all of the infrastructure around it's as if they're lab animals.
Totally.
At least in the hospital setting. But that's
well, you have them chained up. They can't move.
Yeah.
They can't eat unless you give them permission. It is kind of like a lab experiment every single time. I have a lot to say about what you just said because I don't want to use the word occult, but the word occult just means hidden. And if you get in, but if you get into the occult history of our entire sort of written or oral history of human beings, it wasn't always like this. It used to be that even the most prominent scientists, like the original chemist, Paracelsus, they were doing a lot of stuff that we would consider maybe witchcraft in the middle, 13th to the 17th centuries. You could call it alchemy. And
Newton was famously an alchemist.
That's right. He was also probably a part of what we would consider the Rosicrucian traditions, Rudolf Steiner. I mean, there's a lot of people, and not just men, but there's a lot of women as well, who have been really thoughtful about what you just said. And it wasn't until, I hate to pick on Francis Bacon and René Descartes, but I like to do it. At the time, they were these thought leaders. You can call them whatever you want. Philosophers. I mean, they were geniuses in their own right. But there was a time when the church really had governance over what happens with the human body afterwards. And once they started really pushing through their essays for this notion that perhaps the soul and the spirit are separate from the body, which is something I think we all get a sense about now. I'm not this muscly, sinewy person. There's something more to me, like personality, or how much do you love your wife or your kids? There's something there that I can't actually measure on a scale. There's something there. So what is that thing, right? So they were thinking about that. And when they argued successfully that, hey, this is not the dominion of religion, the human body has stuff happening inside, and we want to, and now Galen and some of the early physicians can dissect in and actually look to see what's going on. William Harvey, classically, around the circulatory system, that type of stuff. It seemed to me at that point, like when I'm really into history, so it seems to me at that point, the pendulum swung, and we actually could not only say, okay, you're more than just your body, and all these beautiful facets that you've just described, but now once that person has left, so to speak, we have this body now we can cut into. The problem is that we've like compounded that notion that everything we need to know about the human body is going to be dissectable or something we can cut out and create like a model in some laboratory. That has never swung back. And maybe it's going to start swinging back. I think people seem to believe it is, and I don't think that's the case at all. But there's at least these ideas emerging within physicians. And I hope that we can become really good friends, because while we may not even agree about this medication or that medication, that's what doctors are arguing about all the time. We could at least agree that we have no idea what it is to be Nathan Riley, or you, or your wife, or my wife, or anybody that we take care of in the ICU or in the clinic. And once we can be curious about that, our credentials become less important. And in some ways, we have to actually divorce ourselves of the credentials that were incentivized through a pyramid scheme that got us to the credentials in the first place, that valued us only for our ability to solve mathematical and mechanical problems.
Yeah.
I'll just leave it there. I feel like...
No, it's a good point. I agree with you about the credentialing thing. Like, one of the reasons why I started writing online anonymously is because at the time I thought that the ideas I had were very radical, and to a large extent they are, but now I find more and more people that seem to see things in a similar light, which is nice. But I wanted to see, like, how do these ideas stand up on their own?
Yeah.
And then the other side of that is, I fundamentally believe in humans. Even though I might be displeased with a certain population of them or a certain set of them, I think that people will know when something they hear or read makes sense, or they resonate with it. And so that was one of the really exciting things about seeing the modest growth that I experienced on platforms like Twitter and on Substack, was I'm just saying what's in my mind and in my heart, and if people are resonating with it, then maybe there's something to it. And it's not like I was sharing, videos or photos of things that are it was like long prose, essentially, essays on health and disease. And so, yeah, I'm with you there. Like, I don't think the credentialing thing matters as much, and people like to flaunt it around. Sometimes I get into exchanges and people say, silly things. All right, so what? You're just admitting that you're just like a cog in this machinery. What do you think that you're gaining by bringing this up? What's your idea? How do you think about this?
Yeah.
Just lay it bare. And so, yeah, we definitely need to reconsider what it means. And one of the things that I think truly is, people get like so high and mighty about their position as physicians. I don't think the first thing that most physicians probably need to realize is they are not the source of healing.
Totally.
I think that gets lost. Like,
You forget that.
they think that what they're doing is making people better. Like, they're active, and maybe that's how they justify having constant involvement in their care, like always testing for things, prescribing things, following up on things. Yeah, better to do something than nothing. And I see this as well. Like, orders get done all the time, ordered all the time, just because it makes people feel better, So I want to hear from you. Like, what do you think are the important traits of a good doctor?
Yeah, man, that's a question I've been journaling about, quite a bit. I think the only thing I can say is from the experience of working with doctors that I have like really revered over the years. And there are the people, and when I name these people, not everybody is going to agree with everything that person has done. And we have to get out of that. We actually have to start leaning into, like, if you're going to make a real relationship with your wife even, there are going to be conflicts that arise that you have to work out, right? So my little girls are at some point going to be eye-rolling me for something, and that's a part of having a relationship. So way back in the day, Albert Schweitzer was somebody very interesting to me. He sort of developed this idea of liberation theology, or at least he perpetuated that idea. And one of his mentors or mentees was Paul Farmer. And Paul Farmer, for those who don't know, was a Harvard-trained MD, PhD. He grew up in Haiti, went back to Haiti, and through just observing, I think it was Port-au-Prince, I believe, he was observing the displacement of people after hydroelectric dams had been installed, if I have the story correct, and how these people then got kind of compressed into small slums, for lack of better terms, and then TB became very rampant. And so what he was observing from the World Health Organization was the mistreatment of TB. That's how he was, what he was observing. But his therapy was like to destitutely poor people. And so he would walk into someone's home knowing that they've got a bloody cough. And I'm not going to get into terrain theory and all that stuff because there's plenty there that we can unpack. But regardless, these are sick, malnourished, displaced people without any income. And in his stories, there's a great book for anybody interested called Mountains Beyond Mountains. This was like college years that I read this book.
Okay, we're back.
We're back.
After a slight technical difficulty. Okay.
Yeah. So I was in the middle of talking about Paul Farmer, but
yes.
I won't belabor this any longer. What he would do is he would go in and say, who are you? Get to know them as a physician would. And most of the time, instead of using a script pad, they would be like, you know what I could use right now? I could choose a beer. And he'd be like, all right, I'll be back with, and he'd bring him a little 6-pack of some beer, right? The point of me bringing him up, and some other heroes in my life like Michel Audant and Stu Fischbein, who you've had on the show. He's been a dear mentor of mine for years. Something that I find so captivating about some physicians is that they have at some point, instead of just assuming or presuming that they know what a person needs, they actually lean in with curiosity. And frankly, if we have all the answers, medicine doesn't become very fun anyways. So I think what makes a person who's a candidate to become a medical student or whatever, I think that the best physicians out there are those who are the most humble about what they actually know. And if we're true in answering that question, we don't know anything about anything. I don't even know what this earth is. I don't know what's out there. I don't know what's in here. I am totally perplexed by the whole thing. And that then allows me to enter, using all the tools that I have, but enter into a conversation with a client knowing that I may not have any clue what's going on. And that makes it exciting, it makes it fun, and it helps them feel heard.
Yeah, there's so many layers to that. The fact that you're willing to say, I don't know, gives you the drive to find out.
Yeah.
The other thing is just being able to say I don't know is such a freeing. When I was a trainee, we would get pimped during conferences and stuff. People would get picked out of the audience and ask questions, like take this case. You know what I'm saying? And I remember so many of my colleagues, they would be mortally afraid of not knowing the answer and then voicing that. So they would just try to BS artist their way out of admitting, showing the world that they don't know. And I always found that so amusing. And when it came to me and I don't know, I would just say, I don't know. And people would laugh as if that's like a funny, like, what do you mean? I don't know. We're going to sit here pretend I know?
I would say 6, the number 6. I would just say 6. And they're asking for what's the percentage of whatever, 6?
Yeah. And it became so pathological that a lot of these people that were afraid of giving off the impression that they don't know something is that maybe consciously or subconsciously there'd be a network of them that would whisper answers to each other because they're sitting next to each other so that they can sound smart. And people would whisper answers to me, answers that I had no right claiming as my own, and I would still say, I don't know. I don't actually know. And because I don't know, I don't even know if the guy who whispered something in my ear is right.
Yeah, it's not like you were the worst student and he was the best student. It's like I think none of us really know. So why don't we learn something? So let me ask you, when that would happen. I'm guessing this was in residency or med school. It could have even been in college, but we're never really incentivized, like you said, to say I don't know, or to even just say I don't know. What do you think? Right? So when that were to happen, what would be the response? Like, what were people afraid of?
I think people were just afraid of the world knowing that they don't know something. And maybe it's because, I don't know, this is going to come off as judgmental, but the people that seem to be the most afraid of it are the ones that seem to, well, there's two of them. There's one, people who are unprepared, and then it would become obvious that they're unprepared, and so they think their ignorance is just a function of their unpreparedness rather than the fact that they could justifiably not know something. And then the other is that there's an identity attached to being the all-knowing doctor, and they really have like internalized that. You know, you see that in patient interactions too. Like when I was an intern and I would work with my senior residents in internal medicine and surgery in the ICU, and patients would ask some questions that I know they don't know the answer to because we don't have an answer for that. They would just try to like intellectualize their way through an answer, and I was in my head like, why don't you just say you don't know? Just say you don't know.
Yeah. And yeah, it's beautiful. That's right. We're afraid of being seen as incompetent. Maybe we're lazy. Maybe we're just stupid. We don't want people to think we're stupid. And there's an old saying, P equals MD. I mean, you've heard that one.
Yeah.
You just have to get enough points to pass the test, and they'll give you your medical doctorate. So as a surgeon, OB-GYNs are technically surgeons by training, even though we're not great surgeons. We know like one little part of the body. But when you look at that question of just pleading, I don't know, like ignorance. In the surgical space, first off, all residents are basically a condition never to say they don't know, like you said. But then as a surgeon, there's an ethical responsibility to hand the scalpel to the person who's got the best hands with the scalpel. So, I mean, and that just makes sense. Like, who's going to do the surgery? The guy who has the best chance of doing it right. But when you're training, you're never going to be the best person in the room, so you have to pretend. And so there's this added layer within the proceduralist sort of medical education space, the training space, that not only can you say you don't know, you have to pretend like you do. And when you're holding a scalpel, that potentially is going to lead to catastrophe. And for those who are listening who aren't familiar with this process, there's no attending that's like, go ahead, have at it, and we'll see what happens. But you have to like prime your nervous system to conflate your actual ability with what you're sort of presenting. And so this notion that we're not allowed to say, I don't know, how does that serve us in birth and death? Those are my two board specialties. How does it serve us in either of those specialties when we don't even know what life is? If we don't know what causes labor to begin, we don't know if a baby has memory. Pre and perinatal psychology tells us there might be some memories. Babies are learning while they're in the womb. If you say babies don't have pain, they can't do this, whatever, instead of just saying, I don't know, that actually opens us up to maybe a deep exploration with a bunch of smart people in the room to really look at that question from every possible angle. And I think that is the primary issue within our field at large. If you're not allowed to make mistakes, you never move forward. I'm doing a lot of jiu-jitsu now. And you're just getting your butt kicked. I'm a white belt. I'm just getting my butt kicked left and right. The blue belts, the purple belts, the brown belts, the black belts will take a stab at me. The thing is that they don't want you to sink until you learn how to swim. But it's a part of learning what you did wrong. And that doesn't translate super well when we've conditioned smart kids to always know the answer to the test. Otherwise, they're not valued by society. They're not going to get their name on some sort of landmark paper in the green or gray journals of obstetrics and gynecology, and they're probably not even going to advance. They're not going to get to that place that they've dreamt of going. So you fake it, you charm your way through, you BS your way through, you get just enough points to pass, and then you're left with not much. You're left with this ongoing expectation that you're going to have all the answers. And so my story was like, I don't have any answers. And therefore, if I'm not allowed to ask questions, I can't be a part of this charade anymore.
Yes.
It wasn't fun anymore. And that's why I stepped away. And that has been very successful for me because people appreciate that. They see the credentials. They get it. They got all the diplomas. They know that I know what I'm doing. But when a doctor like you, who has all of these great ideas, all these great essays, do these great podcasts, you've got the MDs, you got all the credentials, when you're like, that's a good question. I don't know, but I'd love to try to figure it out. You don't need to advertise anymore. There's no more
Yeah.
transaction here. There is, whoa, you presented me with something I haven't ever thought of before. And thank you,
Yeah.
client, for doing that.
Yeah, and actually when people ask me things online and I don't know, I just reply to them and say, I don't know. And people will applaud me for that.
Yeah.
And I said,
Thank
this
God
is
for
just
you.
what I do. This is just what I do. I just say I don't know. There's nothing, you know. Yeah. Yeah,
It
well
opens room for a connection, really. If you say, I don't know, you don't know, let's lean in and let's explore together.
Yeah, well, so I have an uncle who's a very learned academic himself, and he and I used to have the same family doctor when I lived in Canada, and he told me that the reason that he likes this family doctor is because this doctor takes lots of vacations. And I was like, what?
It's brilliant.
And he was like, yeah, well, I know this person prioritizes himself and his well-being, so I want that kind of person as my doctor. And I said, oh, yeah, well, that makes a lot of sense, actually. And now that now that I've grown up and have seen doctors and worked with them and become one myself, yeah, like I heavily prioritize the well-being of myself and my family unapologetically, and being able to pay close attention to what makes me and those around me tick and sick and healthy actually makes me a better doctor. Instead of the one who's just work, work, work. He's a hamster in a wheel in like some insurance conglomerate operation and themselves don't look very healthy, but for some reason patients are supposed to take this person seriously and take advice from them. Yeah, like I can see that contrast a lot more clearly than I did, because he told me this before I even went to med school, and at the time I was like, oh, that's
It's great
interesting
advice.
way. Yeah.
I was at an event when I was finishing my residency. The fourth years were being sent off, see ya. And then the interns were coming in, and so there's 5 classes, so to speak, of residents here with all the attendings, and they have this big, like, kind of cocktail thing, and it's at the program director's pool at their house, and there's a woman standing, like, there kind of alone, like, eating crackers or something. And I went over and I was just like, hey, what's your name? I'm Nathan. I'm one of the fourth years. I'm leaving in a couple months. She was like, oh, my name's whatever, Julie. It wasn't Julie. Whatever her name was. She was like, oh, yeah, I'm actually a lawyer, an attorney here, but I'm here as, her plus one of the incoming interns. And I said, well, you enjoying yourself? And like, no, not really. I was like, well, tell me, like, what do you do? And that's how I learned she was an attorney. And she was like, what's interesting about talking to the people here is that most people don't have much to say unless it's something about like a surgical case they did or whatever. Like they're only talking shop. And as an attorney, you have to know everything about the world. Like you can't know everything, but you have to be up to with pop culture and what's going on in the news, and you have to understand, how political divisions are forming and sort of being reimagined. You have to you have to live a life because you have to convince a jury of real people.
Yes.
Like you have to connect with them as humans. She's like, I'm surprised that doctors don't have to do that. And I was like, I think you're talking to the right guy because I have the exact same feelings that your grandfather's friend
This is my uncle.
Or your uncle.
Yeah.
We actually need physicians to be so immersed in their lived experience that they can bring that back in. Otherwise, this doesn't happen.
Yeah.
And, when I do like seminars and whatnot, people will say, why are doctors so, why don't they want to know about a person's story and this and that? And I said, well, let's not just bash doctors. I think people in general, look at Twitter, look at the TikTok comments, look at all of that stuff. Nobody's really living a life. Everybody's just immersed in this, like as if this little thing, this little device in our hand has like this illustrious sort of, it's like a wanderlusting at all times versus going out and knowing your neighbors and having a conversation with somebody who voted for the president that you didn't vote for.
Yes.
Lawyers have to do that because they have to represent their clients. They are the surrogate for their clients. We go in and presume that we're up here, they're down here.
Yeah.
Like the Patch Adams story. We need to make you something better than the people. You're going to be a physician.
Right.
And you're getting too close to people. You're connecting too deeply. It's like, how could you possibly connect too deeply to a person you're about to operate on, or whose birth you're attending, or a person who's dying? And you're like, how could you have all the answers? You don't even know this person.
Mm-hmm.
So everything that you're saying is so true. And in a home birth environment, I am on your turf. I need to, like, I'm going to see tchotchkes. I'm going to see posters. I'm going to see,
Oh yeah.
I don't know, like your Trump poster in the front yard or whatever. It could be like this jerk or whatever, whatever. I'm just using Trump as an example. I have no political affiliations, but I go in and I have to now figure out, how do I fit into this family unit for the moment?
Mm-hmm.
And that requires me to do some deep, heart-centered, curious exploration, because my medical school didn't teach me about who and his wife are.
Yeah.
Didn't teach me about what you guys want. I need to actually get all of that information and then ask myself, how can I be of service to this person, given all of that? And that is a really fun way to go about medicine,
Yeah, it's harder, but man, you're right. It's fun. Like it takes more time. It takes more effort. It takes more vulnerability. It takes more authenticity and honesty and all those things. But there's nothing, I'd rather practice medicine that way than the way I was trained to practice medicine, which is this distant, like the Patch Adams quote that you talked about, where the director of the program was explaining what it means to be a doctor. Yeah, I'm very heartened to see that there's other people like yourself who share this view, because it's not common, and I wonder sometimes why it's not common. And I keep thinking about those 3 traits that I tweeted about that make a good doctor, and I don't want to force examples into those 3 traits, which were humility, curiosity, and courage, but most of the time it seems to fit neatly into those 3 traits. And I'm not saying that I am the embodiment of those 3 traits, far from it, but I'm trying, and I can see that you're trying as well. The humility part is as number 1. I don't know if there's a better starting point, to be honest, whether it's the fact that you might not know some fact in the medical, literature, some concept within the medical arts, or just the person that's sitting across from you. Like, you probably don't know them the most.
You can't possibly know them that well. You just met them. Even if you've seen them for years, they have a story. They are in an internal life that you can't possibly appreciate, like on the surface, I want to ask you about your third point. I know we're going to go over here a little bit. If
yeah, let's go. No, I'm good.
That courage point. Tell me about that. Tell me about the courage piece, because I think that's relevant here.
Well, I mean, it's from my experience, it seems to manifest at every layer, starting with just saying, I don't know. It seems requires some courage. I didn't realize it required some courage, but it seems like that requires some courage. Or when an institution or a physician association requires you to practice in a certain way, you say no. And, I had thankfully there are good physicians out there, even in the medical industry, and I had some good example. One of my favorite was an ICU attending that I really enjoyed working with in Michigan. He would tell stories and he would demonstrate, whether in grand rounds, in the ICU, in the hallway, he would demonstrate this kind of courage. So one thing that, happened to him while we were there is the hospital administrators would call and say, you haven't done enough bronchoscopies this month. We need to hit and for people that don't know a bronchoscopy, you take a scope, you put it down someone's lungs and you look around. And that's indicated in certain cases.
You sometimes waterboard them in the process.
Right, exactly. Yeah, essentially waterboard them in the process. And he was like, yeah, I didn't do them because they weren't necessary. If you want, I can bronch you to get the numbers up. And I was like, yeah, man, forget these, these pencil pushers and stuff. Like, get out of here with your nonsense. You haven't done enough bronchoscopies this month. Like, please. I haven't done it because I deemed it wasn't necessary, all right? So, like, that's courage. Or my own personal experience when I was in New York City when COVID hysteria was in full swing, and I refused to take an injection, and people said that the same people who had praised me the year before for taking part in all the efforts that 2020 required of us, then said that I had to be fired, and I was like, all right, fine. It brought on a lot of hardship. I was at the end of my training, and being a resident in New York City, it was hard enough as it is financially with a salary, but I was like, okay, well, if this is how you want to do it.
When you got fired?
Yeah, I was a chief resident, actually. I was in the last couple of months of my training, and it was a week before my first child was born. So it was, It was a tough one, but I wanna not use that as like for empathy, because the fact that my child was going to be born gave me the courage to decide what kind of a human am I gonna be for this person that's coming into the world. Like, what kind of a father, what kind of a, head of family, what kind of a physician? Am I gonna be someone who cowers, or am I gonna stand for what I believe? And so I thought, okay, for my family, I'm gonna, even though on the face of it, it looked like what I was doing was harming my family, and maybe in the short term it did do quite a bit of harm, but in the long term, it seems to have served us, and I'm very grateful that that's what happened.
Yeah, the courage thing. I am very proud of you for that. That's a really cool story. And what stuck out to me was you decided you'd rather be a good person than be a compliant doctor. Sometimes that courage piece comes through where we're literally putting everything on the line. And this is in some ways to the credit of physicians who are stuck in the system by their own choice, because there's financial pressures, there are societal pressures, maybe even within your community. Maybe all of your friends are at work and now you're going to look like the black sheep, and you get kind of excommunicated from your social network. I hear all of those pressures, but what is happening within the institution of medicine, so to speak, is, I'll tell you a quick story to demonstrate this, is that courage is now not even looking like what you did. It's actually just putting autonomy ahead of whatever, like you're the ICU doc who's not going to do bronchoscopy. Like, it's an uncomfortable procedure. I have to sedate you. I have to waterboard you, and then we can bill your insurance. And without getting into the insurance side of things, let me tell this little story which kind of makes this point very salient. There's a physician, she's probably about 4 years older than I am. She's working at a big academic hospital in Washington State, and a woman, she's an OB-GYN, this doctor. A woman comes in and there's a butt coming out. And I'm sure you and Stu talked about breech. It's something I'm very passionate about. But the sort of modus operandi in most maternity units is that if there's a baby that's butt down, we're not going to do a vaginal breech, we're going to take you for C-section. This is probably the number one reason why we're having unnecessary primary C-sections is a breech. I mean, it is just ridiculous because we just don't train people, and therefore they don't have the techniques to relieve a dystocia in the event that a dystocia even arises. I've attended a number of breaches, and I haven't even needed a lot of the really cool maneuvers that we learned. Anyways, she has this lady come into the triage. It's like the ED within the maternity unit. Baby's butt down, and the woman says, I don't want a C-section. So this doctor says, well, all right, well, let's do this breech. Let's do vaginal breech then. And this lady has a baby. There's no fanfare. There's not even a story here. She had a baby. Goes home the next day, just like anybody who has a baby in the hospital. I mean, for the most part. And this doctor just goes about her day. She has residents that work with her. She trained at this institution as a resident.
Okay.
Like, she is well embedded in this program. So like the next week or so, she gets a letter from the chair, the chief of the OB-GYN department, and it says, Dr. So-and-so, because you have demonstrated that you prioritize patient autonomy over the liability of the institution, here are the following punitive measures that, including you're not going to get the promotion, we have to consider your raise, we have to put you on thin ice now, you're on probation basically, and if you continue putting people's autonomy ahead of our institution's liability, you're going to get canned. It doesn't matter your relationship with us. The bean counters have decided, risk management, whatever. HR is involved, and she calls me. She founds me on my website or whatever. It's like, hey, I want to talk to you about this. And bear in mind, she's 4 years my senior, and she feels completely trapped now within a system that she has given everything to. And it's all because, not because she had a bad outcome, no dead baby, no dead mom, no extra blood loss, no unnecessary procedures, no medical mistakes, nothing, no fraudulent billing, none of the stuff that maybe doctors should be under the radar or the magnifying glass for. This was a totally normal, uncomplicated vaginal breech birth. And the reason I like to tell that story is that she feels like I don't have any option but to stick with it. So to the credit of the physicians, yes. But to the discredit of the collective of physicians, if we all were just a little bit courageous during COVID, during whatever, the medical system could not function.
Exactly.
NPs and PAs can't do surgery.
Yes.
They can't do a lot of procedures. They don't have the training to do certain things. They can't even bill for a lot of the things that are the policy makers. You can't run a NICU without a neonatologist. Doesn't matter what the NICU nurses think they can or can't do.
Yeah, yeah.
It's just the reality. You're not going to have, a bunch of CPMs or even CNMs doing C-sections in the hospital. And even if we have 5 out of 100 babies coming by C-section, the maternity unit has to close.
No.
So the courage doesn't even have to be as extraordinary as yours was, or mine in some ways. I got fired during COVID for taking my mask off, caring for an old guy who was dying of heart failure. He's dying of heart failure. And
That's
he was
crazy.
Like, I haven't seen a face for 18 months.
Yeah.
Take my mask off. I don't need this thing.
Yeah.
Trimmed his toenails, rubbed lotion on his fin. We watched baseball, made him some soup. The next day, canned. So I don't think that came
That's
from a place
wild.
of courage. It was like, I just am a good person like you. I'm just doing a good thing. If I'm going to get fired for being a good person, then I don't need this. You know?
Yeah, exactly.
But man, I wouldn't have put that as one of my 3 principles. But nowadays, you're right. Being courageous is absolutely critical for you to be in a good position. And that's a little bit of kind of a tragedy, I guess, in a way.
It's a real tragedy because, I think, who was it that I think it was Stu who said it. He was like, we pick for anti-courage, most of the time. And he's right. We pick for compliance and we pick for people that will, you show them a little bit of a foot and they're gonna back off. And it's not even you need collective courage in a department, let's say. That helps, of course, because then that kind of covers all the individuals. But it's just micro courage, individual instances, like you're saying, you just took off your mask and you spent time with someone who's on their deathbed in potentially that they just want to feel some kind of connection. And maybe this is a good segue to the palliative stuff, because that was one of the things for me when I was in the wards during COVID. Was these people, it was just so tragic to watch that they couldn't even see or talk to any human that looked like a human, except maybe on the other end of an iPad screen. Right. And to me, that was I was like, oh my God, if this was my mother, so I also did, similar things. I was told, no, you can only spend 15 minutes in this room with this patient. And I was like, are you kidding me? This person's on their deathbed. They have no human contact. You're saying I can only spend 15 minutes in there? Based on what?
Based
on what?
Coming up with an arbitrary rule, Yeah,
so nurses would come in and be like, oh, you're spending. I'm like, okay, yeah, you can go if you don't want to be here. Right. But it was such a, man, that was one of the things that I thought, you guys don't care about the miracle of birth. You don't care about what it means for a person to be on their deathbed. And then after it was you don't care about me despite what I did for you guys during your hour of need, whether that's legitimate need or not. So, fuck all y'all. Yeah.
I mean, even going back to the very beginning of our conversation, people get so stuck on the right or wrong around. COVID's a great example. It was really good because people on both sides were so sure that they knew everything. And it was like, you guys are missing all of this. You're missing the opportunity for us to really congeal as a society and figure out, what do we do when there's a crisis? It may or may not even be a real crisis. It doesn't really matter. You're just going to divide, you're just going to start throwing rocks. Is that helpful? In either direction. More importantly, and to the side of what I would actually argue, the side of the victors, this didn't age well, everybody. And a lot of people like you and me were like, this isn't going to age well. This is probably a miss, but it's because you were curious and humble enough to say, I don't know if I even really understand viruses. That's what I went through. I was like, it doesn't add up here. Something's off. And when we said children can't go to schools, we're going to put masks on everybody. We're not going to give you any human touch as you're dying. My grandfather died at age 100, August 2020, and we weren't able to say goodbye to him. He was not even sick from COVID. He just died of old age. The point here is that we have valued the material thing, going back to the very beginning of our conversation, so much that we have dismissed the art of living in exchange for a prolongation of death. That is really what we have kind of doubled down on. So if you walk into an ICU and there's a person dying, they're not deficient in morphine and benzodiazepines and a ventilator and, pressor support and all of that stuff that we do in, this sort of artificial life support thing that we do. They might actually need, more than anything, somebody to just love them, just to be with them in integrity, authentic human connection. But that doesn't matter because you idiot won't get the vaccine or put a mask on. What is missing? What is a physician supposed to do? What is our role here?
Yeah.
If we're just operators and technicians, then let the AI robots do it.
Yeah. Bring it on.
Why
That's
not?
what I tell people. If you're going to function like an automaton, then you're welcoming your irrelevance, essentially, in this industry that we're trying to help people live a little bit more healthily, even if a lot of the efforts might be futile and all they really need is another soul that can join them on the journey, Then that's how I see myself as well. I don't know if you share this. I'm just a partner in your venture, and that venture is your health and your life. To be honest, I don't even like calling myself a physician or a doctor sometimes because I feel there's so much baggage with that term that I'm just a guide. I'll give you some information, you take you take it, you use it. I don't do the healing. I don't have all the answers, but I'll tell you what I know and what I've experienced and what I've seen, and maybe if that helps you, that's great. I find myself more drawn to just trying to educate as many people as possible on the stuff that I've learned along the way on this journey, so to speak. You know what I'm saying?
Yeah. Well, I know we're going over, but I'm really digging this. And
No, let's go.
We can always get back together on another call, but I think that what you're sort of the reckoning around this is that you imagined being a doctor would be a certain way. And now actually society, in large part because the system itself has shotgunned both of its feet off. It's not just a bullet to the toe. We have really done some damage to develop a lot of distrust between the practice of medicine, those practitioners and the public. We have been not those three things. We haven't been courageous, we have been arrogant, and we have been know-it-alls. Not curious, whatever the opposite would be.
Yeah.
So sure that we know everything, even though we can't define life. Give me a break. By virtue of that, I think you had mentioned this before. I think people can sense that. They sense that we're not good people anymore, and that we don't have the humility to lean in with them into their deepest, darkest things. I have to sit between a woman's lips, put hands inside of there, which was previously just for, sexual intimacy with their partner. And I'm now a know-it-all, and I'm arrogant and all this other stuff. No, thanks. I don't want that. So when I introduced myself, I also, in the past, was very, very cautious around saying I'm a physician, because people now have this impression that was not like it was, whenever. I don't know when it was good, but I imagine there's more Norman Rockwell paintings where there's the friendly family physician who gets to know the whole family for multiple generations. It doesn't feel like that anymore. We just are people operating on behalf of some CEO or shareholders, and people feel that. They don't feel like you are seeing them as a whole person. They don't feel like you're doing things that are outside of the bounds of whatever the bean counters or the administrators or pharmaceutical reps or whatever wants them to do. And so there is a little bit of an embarrassment. I don't want to say this because if I say I'm an OB-GYN, you probably think I'm one of those awful people that traumatized you in the hospital. So,
yeah, exactly.
And it has to be, it's always a conversation there. So I, like you, have had periods of time where I'm very apprehensive about saying I'm an MD, and we work very hard to get there. It's a shame that we have to be, sort of hesitant about that.
Yeah. Look, I don't know if we're going over your time, but I have a few questions that I want to ask that maybe we can talk about OB and one of the things that I have yet to get a satisfactory answer on, and this is something that keeps coming up with every single birth we have, is giving newborns vitamin K. And the reason why I've had this question lingering in my head is, well, what the hell happened before we had vitamin K to give newborns? What were we doing, and why is it that we need to give it to them? And What is the absolute risk of whatever happening going down or up if and when we do or don't give vitamin K? So I guess the first question is, why do we need to give them vitamin K? Why don't they just naturally have the thing that they need when they're born?
Yeah, we could look at this question in so many ways. For starters, the argument is that if you have sufficient vitamin K, I believe it's in the K2 form, which is converted from K1, that you have enough clotting factors and therefore you don't spontaneously bleed, right? The bigger then question is, why don't we, what is this vitamin K thing? We can take this in a lot of different directions, but if vitamin K is a real thing and we give it to a person, we know that it counteracts warfarin, which actually works at the vitamin K dependent clotting factors. And so we know that vitamin K does something when we give it to the body. And at one point in time, when babies were maybe, I don't know, it's really hard to say. I don't want to get too much into like the Weston A. Price stuff, but perhaps our food system has changed. We don't have enough, and babies are now going to spontaneously bleed into their brains or during circumcision or whatever else. And therefore, let's universally do this. And then the question is, well, if we don't do this, what happens? Your baby could die of bleeding. Well, how many babies? It turns out it's something like 9 in 100,000. Like there's not a lot of babies dying from vitamin K deficiency, bleeding of the newborn. It's a mouthful. So a family who doesn't really matter. It's just a little shot. Every kid gets it, right? It wasn't universal, by the way, when you and I were born. Presuming you're in your late 30s, early 40s, something like that.
Yep, late 30s.
Yeah, so it wasn't universal back then, but we decided let's do this because it'll benefit some babies. And what could it hurt? Now, I don't care. I don't want to go into the ingredients list conversation. There's plenty of people out there talking about that. The reason that, I'm not going to say I push back on it. The reason that I have the same question as you is like, if it's a well-nourished mother, is her risk still, her risk actually is not 9 in 100,000, but does she fit into the bell curve in the same way?
Yeah,
and
exactly.
what I always do through Born Free and everything else is let's fall below the average of anything bad happening. So even if the risk to the population is 9 in 100,000, with my support, your risk is going to be, let's say, 2 in 100,000. I don't know. If you decide to get the shot, what they say is it's something like half of that, right? Now only 4.5 out of 100,000. And when we're looking at absolute risk, it's still an infinitesimally small number. There are probably some babies that are still going to bleed anyways, and we just captured maybe 1 or 2 through this injection. So the question then becomes, why are we deficient? Maybe our food systems. Maybe there's other stuff that's happening. But I also actually am doubtful that a vitamin is even a real thing. We're gonna go out there a little bit. I suspect, first off, when we give vitamins, it's always synthetic. So I suspect that when something is connected to life force energy, it is not a material something. It is, we take a piece of you, we dissect it, we cut it up, we put it under a slide, and then we can see something, right? I'm not even certain that a human cell is a real thing, because I can't tell you for sure until it's not a part of the living person.
Exactly.
So anyways, without going too far down that path, we're going to give a synthetic vitamin to a baby. There's a relatively low chance that that's even helping your baby, statistically speaking. And it's coming in the form of a sharp needle. So the bigger question for literally anything in childbirth that anybody's listening to confronts in their life, whether you're a practitioner or otherwise, is we have a very, very perfect human that just came out. Let's assume it was a normal labor, even at home. Normal labor, baby comes out, there's low lights, there's candles, there's maybe singing, maybe there's just whispering, sweet nothings. The point of, let me say, the primary reason that I love home birth is that it is a very safe space. And I don't mean safe like we don't need an operating room. Sometimes we still need those things. What I mean is that the baby is coming into a very alien world, and we want to make sure that they're anchored to some safe point. Their nervous system actually depends on it. This is why babies that are preterm do have a risk of SIDS, higher risk of SIDS, whatever SIDS actually is. I'm not certain that I fully believe in SIDS. I feel like there's something more there that we're missing. But anywho, the reason I think that we're worried about SIDS is, a baby goes home from the NICU and then dies. It's a lot of preterm babies that experience SIDS. There's also term babies. There's also 2-year-olds. There are exceptions to everything. But when we consider how babies come into the world with this cascade of things, there's the quick clamping, there's taking the baby away from mom, there's drying the baby off, sometimes weighing the baby, sometimes doing the hip exam, sometimes doing all that stuff we learned on our peds rotation before mom's even, able to breastfeed. We add to that a sharp needle in the foot, and then the eye goop, and all of the other stuff with a cacophony of noise from the respiratory therapist, the NICU team, all of that. We put all that together, and it feels like a very scary place for a baby. So from my standpoint, I don't know what problem a vitamin K injection is necessarily solving. It feels to me like a solution looking for a problem. And yes, there are some babies that have the bleeds and all that. I get that. If you are going to go down the circumcision route, which I wish you wouldn't, because that's one thing I have a hard no for, maybe giving some vitamin K to that baby is helpful because you're making an incision on their penis. It's a highly vascular tissue.
Right.
Should we do that in the first place? Probably not. Gosh.
Yeah.
So all of this is every time I think about an intervention, I think about how are we orienting this baby to safety, and is this contributing or is it detracting? Now, if there was a 50% reduction in the risk of bleed, maybe this intervention is one of those things we say, we found a really miracle thing, but we're not talking about that. We're talking, it could be 50% relative risk, but if we're talking about 1 in 100 babies becoming 1 in 1,000, that's a that's a windfall of a response. So that's my perspective. There is an alternative, which, of course, if you're breastfeeding, I know they say you're not going to get a lot of vitamin K. I can't help but think that a nourished mother has a baby that has a lesser chance of having a spontaneous brain bleed due to vitamin K deficiency. There's no way around that point. But there's also bioemulsive drops, which are vitamin K drops that you put into the baby's mouth afterwards. And there's a Swedish study that showed that this seems to work almost comparably to the injection. And so whenever a family's deliberating on this, I say instead of a sharp needle, a couple drops of this like emulsified vitamin K liquid on their tongue for several weeks after the birth. I think it's like 12 weeks or something. You do 1 or 2 drops a week. I feel like that's a nice compromise. What other questions have come up for you about vitamin K so I don't just keep rambling?
Well, no, so I think that's the one perspective that everyone talks about, which is that there's a risk of hemorrhage. But I'm of the belief that this is going to get very religious, that things are the way they are because they're supposed to be the way they are. So let me posit the counterpoint here, is that maybe baby's blood is supposed to be thin. Maybe they need to open up certain capillary beds and portal systems that were closed, let's say the lungs, because it was full of fluid. Now this needs to perfuse. And to perfuse it, maybe the blood's supposed to be more thin.
There's a massive physiologic shunt that takes place.
Humongous, and then the liver is now going to start operating differently because the baby's going to start taking things in through the mouth, not through the umbilical cord. And so there's another portal system that needs to be kept perfused and flowing. So maybe there's a protective reason, if it is the case that their blood is thinner, maybe there's a reason for that. And we talk about worrying about the risk of hemorrhage. It's like, okay, well, what about the risk of an underdeveloped lung because some areas clotted when you didn't want them to clot at the most critical point of lung vasculature development, for example?
Totally.
So that's kind of how I've been. This is kind of an insight into how I approach problems. Is I don't go from the perspective of there's something wrong that we've identified that we need to fix. Is there something wrong, or are we just inventing a problem to do something about it?
Looking for a problem. That's exactly it.
Yeah.
I feel exactly the same way. And everything you're saying is not going to now market this as the new latest and greatest thing. It's, I wonder if there's some benefit to the baby not having a ton of vitamin K dependent clotting factors. How could it be otherwise? Why would we have developed that system? And when a baby bleeds in the brain, yes, we put vacuums on the head. We use forceps. There's a lot of things that can be traumatic. Maybe that's a baby we would do that for. But the normal, healthy baby that's just come out of the mom, 4th pregnancy, no issues, no infection, nothing.
Yeah.
Why would we put a wrench in the gears for something that's already doing its job?
Exactly.
It's very hard to be convinced by any clinical study or whatever intervention that this is better than nature. And in fact, we have for too long put the burden of evidence, I'm not going to say proof because that's a mathematical thing. You can't prove anything, but the burden of evidence has long been on the non-interventionist.
Mm-hmm.
It really needs to be on the interventionist.
Exactly, because first, do no harm.
Right.
Right? First, don't do the thing you want to do in case you can cause some harm. Not avoid doing the thing that you wanted to do because not doing something is harm. Yeah, yeah. I feel like we can go down this rabbit hole even more, and there are
eye to eye on this one. I mean, it's really hard for me to be convinced by the literature on vitamin K injections.
Yeah.
Universal injections for the newborns.
Look, Nathan, there's a lot more questions I wanted to ask you that are probably more relevant to home birth and birth in general than the conversation we had, so maybe we can do this again sometime soon.
Let's do it.
Schedule permitting, but I've got a long drive ahead of me now. I got to go up to Canada by car and three kids.
You need to stop in Louisville for a pee break, Mom. I don't know where you're going in Canada.
Yeah. No, we're going through Iowa this time, so it's going to be a new place I haven't been to. Anywho, thank you for joining me. I appreciate your time, and look forward to the next conversation, man.
Yeah, likewise. Thanks for having me.
Awesome.